a lot of people have asked me, well, what does the treatment look like? You know, do you push hard? Is there cracking involved, like in chiropractic adjustments? It's a combination. There is some chiropractic adjustments going on, but they don't necessarily have to be done through spinal adjusting if people have arthritic issues, etc. Force is not the issue. It's hitting the right points, or touching or connecting the right points. And you have to look back at my video on in relation to factor to understand what I mean about eyes open, eyes closed, in the light, in the dark. Also, how is the cranial pelvis talking to the body pelvis? As I explained, this is a pubic bone, this is a pubic bone, this is a pubic bone. There are circuits here that talk to here, here that talk to here. So when we have traumas and accidents, we have disorganization, and these points or circuits need to be connected to each other. Time is not an issue in the sense that you don't need to spend 20 minutes on each point. This is an old paradigm. And the analogy I give for this, talking about force as well as talking about how much time is needed. Now we all understand about computers and keyboards and even cell phones and sending texts and messages. Well, you know, if you make a text and you send it, do you have to push on the glass screen super hard to make it work? Or do you just hit send, the right button? This is the analogy that we need to start adopting, that force is not the issue here. Multiple treatments, you don't sit there and go send, 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 send. Then it's going to be good. Then we need 20 sessions to accomplish the work. It's more so, did you take care of what needs to be taken care of and talk to the wisdom of the body? And the same thing with time. It doesn't need to be sitting there for 5 minutes. If you just hit send, boom, it says this was the code that was needed to talk to the computer or the phone, and you accomplished the job. So let's take a look at a subject. I cannot explain or show the whole treatment, because it takes about 45 minutes to an hour on an adult, but we'll just give you a demonstration of one unit, which is called the gait fault. We'll bring in a subject who I've never worked on. He's going to face the camera, and we do observation. He stands in front of me. Now this is traditional chiropractic, even plumb line analysis. Right away, if you just put the fingers, you can see we have a high shoulder on the left. When I go and check his ears, under his earlobes, you can see it's high on the left. But the curious thing is, when I go and check on top of the crests of his ilium, he's got a high on the right. Anybody understanding basic engineering is going to see that if this has to talk to this, meaning the pubic bone here talks to the pubic bone here, they have to be calibrated, then the animal will stay upright. Meaning it will send the data to the brain saying we know where everybody is, and then it'll send the nerve messages to the muscles, and the muscles will hold the spine and the shoulders and everything level. But this person has taken a trauma somewhere here, 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 or in combination, and his nervous system is frozen in what we call a gait fault. That he's no longer thinking he's in zero. His nervous system is actually thinking it's stuck in a gait with this arm forward, this leg forward, this leg back, this arm forward, this arm back, and then this leg forward and this one back, as if he was in a step, or we call a steppage gait fault. How did that happen? Because he took the trauma, boom, when he fell playing football or something, bang. If you took a picture at the split second that they fell, it would tell you where the trauma happened. We called it the snapshot. We try to find that snapshot. So by law, that means his nervous system still thinks it's out here. So by law, one of these arms is actually receiving neural input, but the other one is being inhibited because that's normal neurology. It's not activating this side, it's activating back here. And whatever's happening here is happening in the reverse down below. That this one is getting activated, this quadriceps muscle, and this hamstring, but this quadriceps isn't. So in neutral, if he faces me, and this is not applied kinesiology muscle testing, this is just testing the circuitry of his muscles to see is there power. Hold this up, he's strong, but if he holds this arm up, he has got nothing. Okay, true? You see? And so if he was a baseball player, when he goes back, his nervous system's fine, but when he has to go forward, the nervous system is in conflict with the action he's trying to do, and there's a ripping of the muscle or a blowing out of the shoulder, or something can happen. He puts himself at threat. Now, going into the in relation to factor, here's where it gets a little more complicated but more fun. Close your eyes, check the same circuit. He's totally strong. Open eyes, So this is not a mechanical thing. We're talking neurology. Okay? And in his case, it's eyes open in the daytime, where he's in this neural disorganization. So therefore, when I lay him down and do the treatment, this should be eyes open while I'm doing the corrections. Otherwise, if his eyes are closed and he's all relaxed and we're lighting candles and doing okay, we're missing it. Not to make fun of the eyes go, that's more of a relaxation therapy. We're talking about getting in, resetting things the way the body needs to be. This is like an operation. So lie on your back, please. If he lies down and we check his circuits, I can tell you what's going to happen. One thing is going to be that one of his legs will not be strong, because as I explained, the neurology in his zero is really here. But when he stands like this, his body is pulling more neural input to one muscle and the other, and therefore that's why people stand all the time. Now as I say this, and people who are watching the videos going, that's me, that's me. That's almost all of us. Now the pelvis is off. Now for the next 20 years, this is a fall when he was 6 years of age, 4 years of age, when he was a kid. But nobody's corrected this. So now he walks, and when he was 10, 12, you notice that he kind of wears his shoes down more on one side than the other. As chiropractors, we were taught, oh, that's the pelvis is off, so we'll adjust the pelvis. Problem is, when he goes weight bearing and he's going out to the receptionist's office to take care of his next appointment, the head is talking to the pelvis got corrected, but the head didn't in relation to the pelvis. So as soon as he stands up and goes weight bearing, he's going back into his disorganization. So we have to correct these in relationship to each other. Until that happens, one leg's always going to be strong, one's going to be weak. In this case, eyes open in the light. So if we take a look here, and we hold this leg up in the air, please. Don't let me push down. Push it up as hard as you can, anytime you're ready, so you can't do it. Okay, and we try this side. It's strong as a rock, correct?
Yes.
Okay. When I go and check the neural input going to both psoas or groin muscles, which are hip flexors and rotators, there's some rotators in there too, one side is in activation, so actually it's pulling, which is why people will say, I keep stretching my groin, I keep doing this, and it just keeps coming back. Remember, the head rules the body. You can't correct this until you first correct this. You can try, but seems not how the universal mind works. When I go take his feet and try to turn them in, well, this isn't the greatest example here, but his right one wants to turn in fairly easily. The left one hits a wall. He can feel it even all the way up to his hip. Okay? And it even creates a pain, correct?
Yes.
Yeah. Close your eyes and try it. All of a sudden, how's that pain? Is it gone?
Yeah.
Yeah. Because it's his nervous system says there, my gait is correct. So how do we test it in this case? Hold your arm up. There's some reflexes found in the pelvis, on the front and on the back, so that the front and the back have sensors to know where's the pelvis in space in relationship to the horizon. Even if that horizon's at an angle, you can walk up it and calculate, and they talk to the head circuits. So when we check his two front pelvic circuits, he's fine. When I check his two front head circuits, they're fine. Okay? Now we have terminology for this, but for demonstration purposes, I'm using simplistic terminology. If you would, please lie on your stomach. Put your head in there. And before I check the back circuitry, we're going to check mobility of the motion of the sacroiliac joints. I lock in the sacrum so it's not moving. Straight leg, please, and you raise this leg as high as it can. And we're about to here. Okay? Down, and try this one instead. Okay? It's a little higher, but how does it feel? Does one feel easier than the other? This one's easier. Okay? So, remember what we said about the front leg being weak, which was on the left, and the back one being on the right, the hamstring. Now we can also test neurological integrity. Your eyes are open?
Mm-hmm.
Okay, so we check the power going down to this hamstring. And this one is fine. But when we go check the power on this hamstring, he has no power. Okay? So I'm not going to use that for muscle testing. What I'm going to do is use this one and check those posterior reflexes. And he stays strong, actually. But when we go and check the posterior head reflexes, hold the leg, we have a problem, Houston. Okay? This is where the thing's going on. This person's history is showing me that he's had a trauma at some point in his life where he clacked the back of his head somehow, and these never self-reset. And so now these two don't know where they are to the back of the pelvis or the front of the pelvis. So the correction is very light, simple rubbing. and breathing. And what we're doing is activating the reflex as well as a light stimulation of the cranial bones. And that's all it takes. What did that take? 15 seconds, less. And power's back on. We find it, we check it, we correct it, we move on to the next thing. The pelvis shows fine on its own. This shows fine. This shows fine. How is this talking to this? That's fine. This back one's in relationship to the front, fine. But watch this. If I go check this on its own, I already corrected that. But how are these two talking to these two? Together, they're not working neurologically. So I must activate them both together. Now when I recheck, here is fine. Then when I recheck these to the front system, these are working. Back to the front left pelvis, we have a problem. So I have to activate these. As I keep working, the history starts showing itself. You can almost see where the trauma most likely happened. Now that this is unlocked, for the first time in who knows how many years, this person's posterior head circuits know where the posterior and anterior pelvic circuits is. So now he's back to plumb line. His head knows where his shoulders are, his pelvis, and they know where each other are. Let's see if this has relaxed the neurology. Straight leg, please, and raise the leg. How's that? Any lighter?
Yes, okay.
Okay, try this side. Okay, that actually got worse. Okay, that's because there are more circuits that need to be corrected. This is a very involved treatment. But lie on your back. More importantly, what I want to show is that this should have taken care of the power going to both arms and both legs.
Okay.
Okay, hold the leg. So now he turns in. Hold this leg up in the air. This is nice and strong, correct? And we can check your arms now. Hold this. This has power, and this has power. So that's something we do in the first 5 to 10 minutes of the treatment. Very easy to do. Please don't just do this at home because you've watched this, because the treatment has a hierarchy. So as soon as you do this, it's going to come back unless you know the next thing, which would be the cranial trauma. And just to demonstrate that, let's say I finished here and said, there you go, that's your appointment, go pay the receptionist. He gets off the table, as I said, and if he goes weight bearing and applies weight on his body, that means how is the head circuit onto the shoulders? Or on his ankles. So I'm just going to demonstrate that just by applying a light downward pressure on his head as if he was standing up, all of a sudden his nervous system has gone right back into disorganization. Hold this leg up, please. Don't let me push it down. And he has no power again. And here. And we go check the right arm. Hold this up. It's in deficit again. This one's still on. So that appointment was really worth nothing unless you do the next thing, the next thing, and the next thing. So this seems to be the living wisdom of the body. You have to do the work and get it done. And we should be grateful that this kind of genius has been brought down onto the planet through Dr. Ferrari, and other predecessors, which he took knowledge from. But the corrections are not forceful. Well, maybe ticklish, but it's just going through like that. So I might be in a treatment like going through the immune system. You're rubbing here, then you're touching some point, then you're going down using a couple acupuncture points, then you go back and drain some lymphatics. This is technical work that you don't really need to know. Okay? If you're in the profession, you'll find it extremely fascinating. That's what seminars will be there for. But for the lay people, just so you know, oh, is it going to hurt my children? I mean, I work on animals, cats, dogs. They have same neurology. Babies, infants. The sooner you can get them in, the quicker you can check everything. We don't need an hour or 45 minutes to go through a baby. Usually there's a few things you can correct, and at least we know your baby's back in neural disorganization, or neural organization. So it's really a matter of just get in, lay down, get the work done, and in 1 or 2 treatments, it's usually done. If you have a new trauma, well, then that's a new trauma. We have to reassess and correct it as we find it. But at least we can correct it, find it, instead of taking forever or letting you live with it for 60 years.